Hi guys, very nice to meet you all, or not meet you, but to be in front of you.
Yeah. So Laura is a known expert in omni-channel marketing and our marketing strategist. So I'm excited to welcome you all on our fifth Nanobot Talks, which kicking off for our omni-channel marketing series. And we planned several webinars focused on omni-channel marketing for upcoming months. There will be webinars devoted to strategy and tactics. And if you have some specific questions you would like us to cover in the upcoming webinars, feel free to reach me out on LinkedIn or drop me an email. Or there is another option after this webinar, there will be a feedback form where you can post also your ideas about what you would like to learn more in the future. And we also will publish all news on our LinkedIn, so feel free to subscribe and follow our pages. While we are waiting for attendees to join, let me very fast introduce Nanobot Group. We are a global digital marketing agency with offices in Europe and United States, and we are dedicated to helping pharma marketers like you are to build lasting relationships with healthcare practitioners. Nanobot, we are experts in omni-channel marketing strategy. We experts also in production of award-winning content, and we have strong technical capabilities and background. Me, myself, I'm from like Salesforce administrator background. I was like sales administrator to 10 or 12 years ago. So we have expertise in Sales Cloud and Marketing Cloud. We are partners with Viva. We developed lots of different visual aids for Viva, IQVIA, eWizard. So to sum up, we are ready to support you on your journey toward omni-channel engagement and seamless customer experience wherever you are that path. So to sum up, we are planning this webinar to last like 45, maximum 50 minutes. So 30 minutes for presentation and 15 minutes for Q&A. If you have any questions, please put those questions into the chat, and during this Q&A, we will cover that. Great. So let's start. Our speaker today is Laura Kennedy. Laura has over 17 years of experience in the pharmaceutical industry. Menarini, Sanofi, Boehringer, 4 years in Novartis, of which 3 years as Director of Campaign Strategy and Planning. Laura has a strong background in brand strategy, customer experience, and omni-channel implementation. I'm very excited to have Laura together with us, and I'm excited to learn more useful information. Laura, it's all yours.
Thanks very much, Andrei. And please, anyone who's here with us today, feel free to post your name and where you're dialing in from today, and if the weather is good or not where you are. I know it's very cold here today in Dublin, and not so sunny. It's really great to be here with you today. So as Andrei said, Andrei, can you see my slides okay?
Yes, everything great.
Perfect, thank you. So my name's Laura Kennedy, and I'm a marketing strategist for Nanobot. And today we're going to cover off digital maturity, and we're going to look at some of the critical success factors to achieving omni-channel success. As Andrei mentioned, I'm 17 years in the pharmaceutical industry, and I worked for several big pharma companies. I've worked in sales, training, brand management, and consulting. Most recently, I was a CX analyst. And I've also been the strategic lead on a large-scale OCE program where we implemented OCE across several global markets. So enough about me. What we'll be covering today, as I mentioned, is digital maturity, what that is and what it means and why it's important. And we'll be looking at 3 critical success factors for implementation of omnichannel. They're not all that's important, but they are 3 that I think are really important. And I think it's always good to deliver things in 3s. So only 3 for today. But again, as Andrew mentioned, if there's anything else you'd like us to cover, certainly pop us a note and we can do that. So why are you here? I did a word cloud of some of your comments. A lot of you are here. The big word here is learn about omni-channel in pharma in particular to understand omni-channel implementation. So that's fantastic. Thank you for that.
And Laura, there also you wanted to mention about the special offer.
Oh, yes, thank you. So before we start, at the end of the presentation, we have a special offer. So for all of you who can stay till the end, that will be on offer to you. So please do try and stay with us until then. Hopefully we'll keep you interested anyway. So digital maturity, what is it and what does it mean? So these are four very well defined and broadly recognized stages of digital maturity: traditional, multi-channel, orchestrated, and omni-channel. And 17 years ago, when I started in the pharmaceutical industry as a sales rep, we were firmly in the traditional space. And what determines where a brand and market is at in its digital maturity is two key things, really. It's the level of personalization of content, and then the IT infrastructure, which determines the level of integration and feedback of the channels. So they're often two key determinants. And in the traditional model, it was very difficult for us to deliver personalized messages. We did have segmentation, but it meant that we had to implement that via traditional channels. And so it made the implementation very difficult. So more often than not, it was a one size fits all with some exceptions. Every customer got roughly the same message. There would be a difference between primary care and secondary care, but not much more than that. And now with the introduction of digital channels, we can deliver more sophisticated personalization of content. So we work up through multi-channel, orchestrated, and omni-channel. We can start to really deliver messages that are bespoke to those customer segments and therefore of more relevance to them. The other thing is channels. So obviously with traditional channels, we have limited channels. When we move into multi-channel, which would be the first progression, we look at adding some digital channels to those traditional channels and getting some feedback. And then moving on to orchestrated, we have more channels and perhaps we're introducing some segmentation at that point. And we have a closed loop, we have feedback KPIs, but it may not be fully integrated at that point. So some of those entries, some of those KPIs may be manual, for example, depending on the tech stack that's available. And then as we move on to omni-channel, we have more advanced tech stacks and the channels are integrated. So what's happening at that point is the sum of the impact, or the impact is greater than the sum of the channels because they're integrated. So we're getting to a place where it's right channel, right customer, or right content, right customer, right time, etc. So that's a brief description of what digital maturity means. There's more to it than that, but that's a high level description. Why is digital maturity so important? So really with the more advanced we are, the more mature we are, we have the ability to gain more data about our customers. So it offers us the opportunity to gain a deeper understanding of our customers. And those markets and brands that are more advanced in their digital maturity will be data rich relative to maybe brands and countries that are using the traditional channels. There's real-time leading indicators as well. So we have real-time feedback, and those insights should be actionable as long as the strategy is tied together nicely. And what that offers is better customer experiences in theory, and ultimately a more cost efficient and higher margin model, although the setup costs are higher in the beginning and the learning is higher in the beginning. So there's a little bit of a bump to get over until we get to that point. So moving on to three critical success factors then, what I'd like to cover today is customer insight and the importance of that, choices and leading KPIs, what those are exactly and how we achieve them in the setup of our omni-channel campaign. So before I get into that, I have a little statement for you, which is that customers will buy when they're ready, not when you are or when we are. That was a statement on the back of some market research or a study that the Ehrenberg Bass Institute did in not just in pharma marketing, but in e-commerce in across markets. And they found that 95% of the time customers are not ready to buy. Only 5% of the time are they ready to buy. So what does that mean for us? It means that we need to think about long-term as well as short-term activation. So when I think of short-term, I'm thinking probably more product-focused, and then long-term, more customer-centric in the content and messaging that we're putting out. And all of that needs to support the identity of the brand. And then our customer journeys must meet customers where they are based on their agenda. And I'm going to come back to that in a specific example later. That's a really important point for when we develop our customer journeys. Okay, so at a very high level, first of all, starting off, we have the brand plan and the channel plan, and ideally a closed loop between the two. When we think of traditional brand planning, we have the SWOT analysis, which is, the basis of most plans. We have the opportunity analysis, the threats analysis on the external environment, and internally, we're rating our brand relative to other treatment options that physicians have, target physicians have. And there are strengths and our weaknesses. And what we want to do is leverage our strengths, mitigate our weaknesses to take advantage of the opportunities in the environment and mitigate the threats. And often that can be quite a brand-centric exercise because we're very focused on what are our key strengths and how do we leverage them. Obviously, the opportunities and threats are externally focused, but the channel plan is where we need to be truly customer focused. And we need to be customer centric, being the term that describes that. We need to orientate ourselves in the world of the customer. And we need to be very curious about the world of the customer and empathetic. So we need to develop new mindsets where we're really investigating the world of the customer. So coming on to customer insight then, first of all, you'll all recognize this figure, Sherlock Holmes. He was an investigator, but not only that, he's holding something in his hand, which is a lens or a microscope, or sorry, a magnifying glass, but it could also be seen as a lens. And lenses are really important when it comes to customer insight. Sometimes we need to be agile enough and dynamic enough in our approach to apply different lenses, to look at customers in different ways, to get a holistic understanding, that whole person understanding. So how do you work through customer insight in a methodical way? So the first place that I would always start is I would trace the patient. So this is a very simplified visualization of the patient journey from first symptoms through to treatment optimization and real world outcomes. There's a journey that the customer takes from those 2 points and onwards. It is distinct from the treatment pathway, which is the thing that exists in hospital documents and describes the functional pathway that the patient takes, perhaps through primary care and into secondary care. This is a more holistic representation of the patient's journey, and it includes emotional factors, and it includes all the different stakeholders that they might interact with on that journey. And it's a great lens or framework to use when we want to dive into the world of the customer, the world of the patient, because it tells us what's happening to the patient, who's interacting with the patient, what is influencing them, what they are thinking, etc. So it's a great way to uncover all of the necessary insight. I mentioned the stakeholders on the patient journey. How do we look at those? So again, we use another lens, which is we look at what they're doing. We look at their behavior. So we might look at what they're doing today. And then we want to look at why they're doing it. And one of the traps we can fall into in the pharma industry is we can think, oh, we want to educate doctors, that will educate them, which is great, and that's important. But education sits with knowledge, and it's actually only one of the behavioral drivers. There's also capability, environment, and motivations at a high level. So do they feel capable of doing what it is that is being asked of them? Does their environment support them? Do they have the necessary diagnostics, the necessary funding? And are they motivated? Do they care enough to do what it is that they're being asked to do? So those are all important questions that we need to ask, and we need to be ready to get the true answer, the customer's perspective on those drivers. Another lens we can apply is jobs to be done theory, which is what is the customer hiring the brand to do? And what we have in this one, we have 3 concentric circles here. At the core is the functional job. So if it's an anti-diabetic drug, then it's the core job is it reduces HbA1c, and nowadays often it's also protecting the patient from cardiovascular risk or weight loss or whatever it might be. That's the core functional job. But from the customer's perspective, there's also a set of related jobs depending on his his or her segment, or his or her own lived experience. So, for example, a related job often in treatment of patients is, doctors don't want to be sued, so they want to get the treatment right. That can be a related need, or it can just be about having happy patients come back, depending on the stakeholder. And then the social and emotional needs can often be things like, well, what are my peers doing? Am I in line with what my peers are doing, or am I different to my peers? Some want to be different and want to be the first to do something. So again, it'll depend on the segment. But what this lens affords us to do is to be really curious about the whole person experience, further out from just the core job. And when we look into those other needs, we can start to get a holistic view of what it is that the customer wants, what a good day looks like, what a bad day looks like, and how we need to talk about our brand such that it's meeting both the core related social and emotional needs. Okay, so the next thing then is choices. I have the Roadrunner here, and the reason I have the Roadrunner is I was a brand manager for many, many years, and I know how busy the job is, and it's not just busy for brand managers. It's busy for the medical team, it's busy for the market access team, everybody's busy. And so all the more important that we make strategic choices, what we're going to do and what we're not going to do as a group, as an aligned group, because otherwise we can miss where we need to focus. And also when we make clear choices, we also create a more mindful business environment, less rushed. When we try and do everything, we're spread very thin. Whereas if we're focused, we can be more mindful, more relaxed, and we can preserve ourselves as well, which is a related need that we have when we're doing the job. And also we increase impact when we're more focused. So how do we make choices? So again, another lens or another framework, which I can't emphasize how powerful this framework is the market map, or some refer to it as the quantified flow. And we need to use a little bit of design thinking when we're developing a quantified flow for any medicine and market that we're working with. It follows, you'll be familiar with this flow, population prevalence, diagnosis, treatment, etc. But it's really up to you to design it based on your brand's context. What might it look like? I've developed a very generic one here where we have patients treated and we have 2 classes, and then we have different brands underneath each class. So, and by the way, this is something you can do yourself. If you need any help with it, absolutely reach out to us. We can support you with this. So the way to visualize this flow is that patients are flowing down through it, and like a leaky bucket, there are patients flowing out at any point. So for example, here from prevalence to diagnosis, patients mightn't be diagnosed, or from diagnosis to treatment, they may be diagnosed but not get the treatment that they need. So we need to make choices around which levers on the flow or on the market map we're going to address. So for example, we can look to improve diagnosis. We can look to grow the class by driving preference for class BB, or we can look to drive preference of our brand within the class. And where you decide to focus will be dependent on your brand context. So if you are new into class, for example, new brand launch, but the class is very well established, then you may like to focus on driving preference because it's all about winning share from the other player in the market. If your brand is very mature and you have good market share and growing market share, then you might like to grow the class, or you might like to improve diagnosis. So it will depend on your situation, your brand situation, where you want to focus. But the most important thing is that you as a team are aligned and you decide this together. So another lens is in the brand planning process itself. This is the customer journey again. And one of the things, particularly with channel planning, we need to do is we need to understand what the pain points or moments that matter are for the customer on the patient journey. And there may be many of them. So I always like to think of brand planning as a hourglass on its side. We have insights on the left-hand side and KPIs on the right-hand side as the output. In the middle, we have this apex point, which is where we're making choices around what we're going to address and what we're not going to address. And it happens once we have consolidated the insight And so we've expanded, we've diverged on insight, we've consolidated what we feel we know, and we have worked them down into opportunities and threats. And then we've carried out a prioritization exercise. So for example, with the opportunities, we might rank them in terms of business impact if realized on the vertical axis, and then we would draw them across in terms of our capability to address. We would do the very same thing with the business threats. We would overlay the two and synthesize the key issues, which is the summary of the two. And that gives you no more than 6 or 7 business key issues, which represent the holistic challenge for your brand, including all the customer pain points. But what it is it's prioritized. So you have key issues above the line and key issues below the line. Those above the line on the right-hand side are the things that you're going to do tomorrow. You can do them tomorrow and you're going to take advantage of them tomorrow or today. Build on the left-hand side are the things that you need to build towards. So that might be, it could be improving the pathway, it could be changing perception, but it's something that you are not going to be able to take advantage of until you shift that box right. Everything below the line on the left-hand side, withdraw, is everything you as a team agree you're not going to do. And then on the right-hand side, those are the things that you're going to address choicefully. And the great thing about this document, this particular slide in the brand plan, is the most important one, because inevitably in the cycle of planning, maybe somebody new joins the team or somebody has a great idea. And the temptation is to say, yes, we'll do that. But no, it's really important to come back to this slide and in the context of the decisions you made as an aligned team, assess whether or not you're going to activate on that tactic. And then the last one here is right fit personalization. So your customers currently exist within your CRM under a functional segmentation. So for example, on the left-hand side, we have primary care physicians and specialists. And those customers are organized according to their value or potential and penetration. Often we call it tiering. So you might have 3 levels of tiers for GPs and the same for specialists. So that's what the majority of pharmaceutical companies work with as a baseline. Now, when we think about personalization, we think, okay, so do we need to add an attitudinal lens on here? And often primary care attitudinal segmentation will serve up maybe 4 segments. You've all seen them: the empathetic type, the authoritarian, the different archetypes of customers. The challenge when we add in attitudinal segmentation, though, is we go out to many more segments. That, in fact, becomes 4 per tier, and it becomes 24 segments. And if we add channel preference in, we're going up to 72 segments. The challenge with that is it becomes very difficult to implement one and measure and iterate on 2. So the feasibility of 72 microsegments can be poor, essentially. Equally, on the left-hand side, the one-size-fits-all customer journey isn't quite right either, because your reach and engagement will not be optimal because the content is not tailored to the needs of that customer and mightn't necessarily be relevant enough to them. So somewhere in the middle, there's a right fit, and I'm going to talk you through one way that we can achieve that now with an example. So let's take this imaginary brand. It's not a brand that we as Nanobot have worked with, but we're using as an example. These are not real insights. So they're insights that we imagined up, but they're fairly reflective of the types of insights you would see with any brand. So this brand is a new non-hormonal treatment for hot flashes or flushes, a symptom of perimenopause or menopause. And here we're looking at primary care physicians. And we've considered that in primary care, there are 2 groups, 2 behavioral types, roughly speaking. There are those that proactively treat symptoms of HRT and those that delay treatment of symptoms with HRT. HRT is hormone replacement therapy, which is a well-established therapy for treatment of symptoms of menopause. The interesting thing then is, as we dig into the insight, we see that there's actually more than 2 segments. When we start to look at the attitudes and intrinsic motivators, there are 2 segments that sit under the proactive treatment type. There's a group that like to do it because they actually know and like to stick to guidance to guidelines, and guidelines recommend the use of HRT as a first-line therapy in the majority of women. And they like to stay between the lines. The others do it because they really believe symptoms of menopause should be proactively treated. Perhaps they've had family members who've suffered through this phase of life, and perhaps they're just a very empathetic type and they really want patients to have a better quality of life. But that's their main driver. And equally on the other side, where we have delays treatment, we have those who believe menopause is a natural part of aging and it's overtreated. And actually, I'd rather use diet, exercise, lifestyle advice, reducing alcohol first. And then there's a fourth one who prefers to use SSRIs or SNRIs, which is another commonly used therapy for symptoms of the menopause. So ideally, what we would want to do at this point is to size each of these segments, to know how big each of them are, and then to do a rating on our ability to win based on what we understand of these segments. And ideally, then you could then prioritize. So here we've made this up, but here we've prioritized two. We've said, no, the first priority segment, or the low-hanging fruit, will be those who believe symptoms should be proactively treated because they're already doing the behavior we want them to do. We just want them to do it with a different treatment. Four then would be underneath that, which is using SSRIs and SNRIs. The insight with this segment is the reason they prefer SSRIs or SNRIs is because they are hesitant due to the accumulated risk associated with HRT. With a non-hormonal therapy, you have effective treatment of symptoms, but you don't have the associated accumulated risk associated with HRT. So that's a good second priority segment, and so on. Okay, so third one, leading KPIs. I'm using the iceberg analogy here because above the water is the behaviors and below the water is what you can't necessarily directly see, which is all of those constructs or drivers of behavior. And leading KPIs are tightly grouped with these. So again, using this example to bring it to life, I'm going to pick one of these segments and I'm going to talk you through an example of how we create leading a customer journey and leading indicators. So here we have the segment who believes menopause is a natural part of life and actually it's overtreated. So how are we going to start a customer journey with this particular stakeholder? Well, I like to use reach, acquisition, conversion, and engagement. That's the framework I use. It's not necessarily the right one. There are other ones out there, but I'll use it for example, here. And the first question we need to ask is, how are we going to grab their attention? Imagine we don't have a field force and we only have digital channels. How are we going to grab their attention? So we might start by acknowledging their belief, which is that menopause is a natural part of aging, which it is. But we have a but in here. And here we're going to talk about the symptoms and the impact of the symptoms. But before we do that, we need to ask ourselves a question. What do they value? If we consider that women with symptoms of the menopause suffer from physical health problems, emotional health, sexual health, sleep quality, work productivity, and relationships, we need to ask ourselves in the reach part of the customer journey, what is going to resonate with this stakeholder? So if I give you the description of them here, they consider themselves experienced and authority on many topics. They care deeply about their patients, but prefer to do what they consider is right. They're not keen to adopt new therapies until there's adequate proof. So here we need to actually ask the why behind the why. Who is this person? There's a great analogy. I was at an e-commerce next gen conference last week, and one of the speakers said, data is great, but until you meet the person, you don't know who they are. And the analogy he used was internet dating. You know, you can look through all the profiles, but until you meet the person, you can't really get a sense of whether you like them or not. In this case, it's true, you don't really know them until you meet them. And so this is where the importance of hypothesizing and using research where possible really comes into play. We need to ask ourselves, which of these symptoms will resonate most? Would it be work productivity, for example? Because one of the things that gets under the skin of this particular persona is having to write 6 certs all the time. So we just need to ask ourselves that question. And I'm not saying that's what it is, but pause and ask the question, what will resonate? Let's not just throw the kitchen sink at them. And I want to show you how that's different for another segment. So in the reach part for the SSRI user. They're concerned about the lack of evidence to support HRT in early menopause due to the associated accumulated risk, and has seen some great results with SSRIs where patients come back and they feel really happy. So again, one way to grab their attention might be to acknowledge that SSRIs are great for many patients whose primary symptom is mood and perhaps have a history of depression. That's a great way to go. But there's also a large majority of women with moderate to severe symptoms where hot flashes are the most troublesome symptom, and SSRIs unfortunately are not very effective there. And great news, there's new hormonal therapies which are not associated with the accumulated risk that you're concerned about. So again, just showing how the reach part of the customer journeys are very different for those customers. Now, leading KPIs. Leading KPIs are about measuring measurable shifts between reach, acquisition conversion, and so on. And they can be behavioral, but more often they are constructs that underlie behavior. So let me show you how that works. If we take the example of the person who believes menopause is a natural part of aging and doesn't want to believes it's over-treated, here we might say, yes, you're right, menopause is a natural part of aging, but moderate to severe symptoms can affect work productivity and home life when we've done our research, et cetera, et cetera. And we might back that up with some authority, maybe some guidelines and things like that as well. But the point here is that this customer is placed in the reach part of your customer journey within your CRM. That's where they sit now. And they do not move forward until they are rethinking their approach to treatment. Until that time, they stay there. And we test our content and see if it moves them. And if it doesn't, we go again. We reiterate it and we learn. But we do not move the customer on until we think they are rethinking their treatment approach. So here we're getting a belief or attitude change. That's what we're looking for. That's our leading KPI. And in the second part of the customer journey, at that point, we might say hot flushes are the most troublesome. There's novel therapies available. We'll talk about the brand, the mode of action, the efficacy, the safety, the patient numbers, the expert consensus. And again, this customer is not going to move forwards until they consider hot flushes are the most significant or of significant burden, and targeted therapies are a great choice over HRT because of accumulated risk. Only in the conversion part, so that's a knowledge and awareness KPI. Only in the conversion part are we actually going to ask them to prescribe. So here we're going to give them reasons to actually try brand X in 2 to 3 patients. So it's only until the conversion part we're actually seeing a KPI that's a behavioral shift. So that will show up in the form of a sale. So that's a lagging KPI. So has trialed in 2 to 3 patients, and then engagement is about improving or increasing use beyond that. And I think I'm just coming in on time, Andrea, am I? And that's it. So hopefully that's given you a good understanding of digital maturity and some useful pointers in terms of success. Obviously, we can help you with any of the things we've covered here. If you'd like to know more, we're very happy to speak to you.
Yeah, great, Laura. Thank you so much. Maybe you can switch to the next slide.
Yeah.
Yeah, so guys, thank you for staying with us till the this slide. You can just scan the QR code and you will be redirected to the page where you can register to have this special offer, our free consultation. It will stay a couple of seconds more, this web page. And yeah, I have some questions regarding you spoke about meeting the customer to understand them. So how in practice do we achieve this? We are getting into Q&A session.
Okay, perfect. Okay, so sorry, the question again, Andrei, sorry.
So you spoke about meeting the customer, right?
Yes.
Meeting the customer to understand them. So how in practice do we achieve this?
Yeah, so this will depend on your context. So if you have a large market research, or if you have enough market research budget, then you can do some market research, okay? But I want to caveat that please don't go and do primary market research, because often we don't really find the answers to the questions we want to ask when we go straight to primary market research. A great way to work through that is to take the insights that you have, and like I mentioned, consolidate them down in terms of what are the behaviors you're observing and why do you think you're seeing those behaviors, and can you answer all of the answers to the different constructs that underlie behavior. And equally, when we think of the market map, where on the market map are you focusing? So when we think, if I use, for example, a generic example like the treatment of diabetes, if you think of any brand in the treatment of diabetes, usually what they're trying to do is they're trying to win share in patients on metformin, because that's the first line treatment for diabetes. So what is the interaction like for a patient who's been on metformin? So you have those who are newly on metformin, and possibly what's happened in the run up to that is their doctor has said you're pre-diabetic, you need to manage your diet and exercise, or you're going to have to take treatment for the rest of your life. So the patient has gone off, tried, managing their diet and exercise, and now they've come back and the doctor has said, I'm going to need to start you on therapy. How does that make the patient feel? How does that make the doctor feel? So it's really getting into the human nuance of these scenarios. And then when we call on a doctor like that, or we're promoting to a doctor like that, and we're asking them to initiate another therapy early, what is the concerns there for them? Well, the doctor might think, well, I want to give the patient a chance to, number one, take their metformin every day, because they're probably thinking, oh, well, I was very good today, so I won't take it today. So they had to have a few conversations with the nurse about the seriousness of their condition and get them to take their metformin every day so that they can accurately read what effect it's having on their HbA1c. So these are all the things that we need to play out in our minds to really try and understand the dynamic between the patient and the doctor, for example, in any given moment that matters, rather than saying, we'll just try and grow our brands everywhere and try and take share from other brands, etc. No, where is the growth opportunity and what's happening in that specific spot at a human level? And then we can use a little bit of ethnographic research, for example, to investigate that further. We create a hypothesis as a team. We believe this is what's happening. Then we ask very pointed questions in market research, which validate or invalidate our hypothesis. And then we start getting a really accurate picture of how we need to address that situation with our communication and our customer journeys. In situations where you don't have a lot of budget, there's another fantastic way of doing it, particularly if you have a field force. I've had a situation where we interviewed our field force. We developed a customer-centric survey, a set of questions that were all about the customer. We interviewed each of the field force for 30 minutes each, and we got some amazing insights from them. And it was really about asking them, why do you think that is? What do you think? What do you think is going on in the background? And from that, we synthesized not only a great understanding of the world of the customer, but also some really nice personas that helped us to meet that middle point, which was 4 or 5 customer journeys that were feasible.
Impressive. Another question. So guys, if you have questions, please put those in the chat. Just type in the message. So I have another question. So you mentioned also leading indicators. So how do we measure leading indicators in practice?
Yeah, so again, here we're talking about the kind of the reach and acquisition part of the customer journey. How do we measure them? Because we're not seeing an actual behavior shift. And obviously, where there's a field force and presence in place, this is where a field force who is customer centric and curious in their mindset is so important. So, but this is really a partnership, because the segments and personas that you create must be ones that your field force identify with and agree with. So the more you can work together on that with them, the better, because they will be aligned and bought in and believe in it. And then when they call to those customers, they're going to ask questions using their natural selling skills and taught selling skills and experience to understand where the customer is on that customer journey. And if they haven't moved forward, why they haven't moved forward. And that's great feedback. That's why we need formalized sessions where we can work on segments, specific segments, and understand if they're moving, why they're moving, and if they're not moving, why they're not moving, so that we can adjust the content and make the customer journey better.
Cool.
Sorry, the question again, Andrei, was?
So how do we measure?
Sorry, I got a little bit lost. That was the field force answer. If you don't have a field force, then you only have digital channels. So it comes down to content. So here what we need to do is serve up content and see if the segment is engaging with the content or not. And this is where A/B testing is really important. Having different fragments that you can test and see what the engagement is like. Also, Nanobot has some great examples of ways that they get customers to actually interact through gaming, through questionnaires, anything like that. If you can build it into your customer journey, give the customer an excuse to interact with you, offer up some valuable content if they do, whatever it might be. That's a great way to get feedback also.
Thank you so much, Laura. We have some technical issue, guys. I just received information. The chat was disabled. Right now it is enabled, so feel free to put there your questions. We will see those questions. I don't know why this happened. Okay, thank you so much, Gavel. So another question which I have, like, how do we get our brand messages across as well as customer-centric content?
Yeah, so there's two aspects to this question. We talked about long-term activation, short-term activation. First and foremost, at the brand level, are we doing that work to really understand the holistic needs of the customer, not just the rational needs, but the social and emotional needs? What are they hiring the brand to do? Without that understanding, we can't know what aspects of our brand are important to the customer or how we need to position the brand in order that it's answering the customer's needs. So the answer really starts in insight. So even when we are doing the short-term messaging, which is very brand-centric, it should be still customer-centric because it should be answering tangible needs or pointing to tangible needs that the customer has. In terms of the long-term and the customer-centric, one of the challenges is, from a practical perspective, is, oh gosh, I have so much content to get approved and I have to get these customer journeys, and it's a lot of work. My messages start simple, really start simple. Start with your brand messaging. You need to work out what your reach is anyway. If you have segmentation, hopefully you do. What is the key starting point with that segment? Then you need to just implement minimal content there in the beginning. Work through the stages in your customer journey, put in your brand messaging, your customer-orientated messaging about your brand, and measure that. Get a closed loop going and start measuring, and then build on it. You know, see what the feedback is like. Get something going, get the closed loop going. Less is more in the beginning. And then once you have that established, then start to build on, you know, the more customer-centric content and the more high-value assets, etc. So start simple and iterate is what I'd say.
Great. Thank you so much, Laura, for insights and for the presentation. It seems that we fit exactly into 45 minutes as we planned. So guys, if you have any additional questions, please put them into the chat. If so we can reply. 1 minute we will stay online. Overall, thank you so much for joining us today. We have this recording of this webinar. Later we will send you in a separate email. Right now, so we have.
Thanks, Claudia.
Thank you, Claudia. So yeah, there will be, as I mentioned, the form right now. So please do send your replies and your thoughts about the webinar, if you like the format and what additional information you would like to have from us. So thank you so much. Have a nice day, and let's stay together, and we will inform you about our upcoming news and upcoming webinars. Have a great day. Bye-bye.
Thank you so much.
Thank you, Laura.